This presentation is designed to help you know what to expect in the clinical portion of your nursing program, or your door to clinicals. Welcome to the clinical portion of your nursing education. Students who have a plan to manage responsibilities and sequester serious study time have made good preparation for success. You're learning the necessary skills for one of the most highly regarded careers in the world. Nursing is embodied in Dr. King's quote, "Every day presents an opportunity to make a difference in someone's life." In this presentation, we will discuss the varying times of day classes are offered, what it means to be a nurse, the great risk of overcommitting, what a nursing student can expect for time commitments, and what nursing instructors expect of students. Nursing instructors say that if a student is passionate about nursing, no job is more rewarding. You'll begin to learn the truth to this quote as soon as you have your first lecture and your first patient assignment. Learning and successfully completing nursing will be unlike anything you've done before. It requires a special set of skills in many areas, including critical thinking. When students are paying attention to these skills, evidence shows they are more successful. Due to recent budget cuts, we are no longer guaranteeing fall and spring admissions. We will announce any change with as much notice as possible if we should have to make that revision to our program. So far, this hasn't been necessary. If a student begins nursing clinical courses in August, fall semester, they'll have the choice of attending later in the day. But for example, surgery, children's clinics, and OB clinics are available only during the morning, so students must have flexibility. Students enrolled in the Transition ADN program have 3 semesters, or approximately 16 months, excluding summer, of clinical coursework to successfully complete in order to graduate from the program and apply for the NCLEX RN exam. The clinical courses are sequential and can't be compressed into any shorter amount of time. If a student begins nursing classes in January or spring semester, they'll have the choice of attending early in the day. Many clinical sites are available to students only during the day, so your scheduled clinical hours should cover time-sensitive areas like surgery, children's clinics, and OB clinics. The nursing process. A student will hear this term mentioned in every nursing course until graduation. It involves critical thinking, assessment, nursing diagnosis, planning, implementation, and evaluation of nursing care. Each sequential course builds on the knowledge, skills, and critical thinking a student is gaining, becoming more complex and involved with each semester. Learning will be different. Memorizing is what you've done all your lives to pass tests. And that would be an example of a question like, what is a blood pressure? Understanding is knowing how the facts you learned work together. And this is an example of that. What does 120/80 mean, and is that okay? Application is using the understanding to solve a problem. For instance, should I give blood pressure medication? How and when? Nursing school is very demanding. Students have a hard time believing this slide until they actually enter nursing clinical courses. Then sometimes it's too late. A student who doesn't have enough time to really study will spend the rest of a semester playing catch-up for a failing grade. It takes at least 3 hours of study time for each credit hour of class. The students we see at most risk of failing a class are the ones who add too much to their nursing school schedule. Some students try to retain a full-time job or combine nursing with other courses. We include this information for your benefit. If you know ahead of time that you're putting yourself at risk, then you can plan for management of your time and family responsibilities. Online modules may be needed to complete may need to be completed, and pre- and post-testing to learn skills. Study habits may need to be altered to fit new content. The reading is more difficult with unfamiliar terms and content. Some relearning of areas like math may be needed for medication math calculations. Opportunities for unique learning may be made available outside of normal class or lab hours. Students may be required to go to the clinical facility the night before the clinical visit to receive their patient assignment. Students should expect to spend time in preparation for instructor discussion and questioning on patient charting, being familiar with pathophysiology and treatment, and a plan for nursing care for the clinical day. These represent sample clinical skills taught or reviewed in Nursing 145-146. These skills will be taught in the lab or classroom prior to going to the clinical site. Students have found it helpful to review skills checkoffs in the text and video presentations on the nursing lab computers. Along with Med-Surg, Nursing 145 and 146, you will take Nursing 162, Psychiatric and Mental Health Nursing. Once students receive their patient assignment, they will study various conditions, drugs, and procedures. Your clinical instructor will ask about your knowledge of the condition of your patient to make sure you have prepared for this interaction. Students are responsible for being familiar with patient care, medications, and treatments. This is a typical schedule for Nursing 158-117, sometimes called OB and PEDS. You will study acute and chronic illnesses and health maintenance for patients in childbearing years and all stages of childhood and adolescence. Normal aspects of care and growth and development are also covered in this course. A variety of community sites are chosen to provide the student with an opportunity to incorporate theories of human development, growth, birthing, behavior, teaching and learning, and family constellations into client care delivery while utilizing the nursing process. This is the schedule you can expect in your last semester. Nursing 221, Advanced Nursing, expands the application of the nursing process, critical thinking, planning, implementation, and evaluation of nursing care in the care of persons throughout the lifespan who are experiencing trauma, burns, respiratory failure, and chronic neurological conditions. Also, the student is provided the knowledge to lead and manage the healthcare team, utilizing appropriate delegation and evidence-based nursing. Students work the same schedule as their assigned clinical preceptor. You're entering one of the most respected and trusted professions. We expect you to conduct yourself as a professional. That means arriving on time even if you had trouble sleeping the night before, being prepared by pre-reading content before class, making a sincere effort by participating in class to understand and clarify, and taking responsibility for your actions and your learning. I want the transition students to come rested, eager to learn, and curious to discover what they have to become to call themselves RN. I want them to be open to new ideas and ways to learn. They must be willing to take responsibility for their own learning and ask when they need help. They should not settle when they don't understand. I want to see excitement, not boredom. I want to hear, "Can I practice these skills on other days than Tuesday?" Or, "How would that look if my patient had that problem?" Not, "Do I have to stay all 5 hours?" Or, "Is that on the test?" This was a quote from an instructor for nursing. Once a student who is self-disciplined stays on task as needed and manages time to focus on priorities, is one who is sensitive to diversity, expresses appreciation of human differences related to values, culture, and personality. A student who is reflective and self-corrective, carefully considers meaning of data and interpersonal interactions, asks for feedback, corrects their own thinking, is alerted to potential errors by self and others, and finds ways to avoid future mistake. Is one who is courageous, stands up for beliefs, advocates for others, and doesn't hide from challenges. A student who is flexible, changes approaches as needed to get the best results. Is one who is empathetic, listens well, and shows an ability to manage to imagine others' feelings and difficulties. Student preparation helps make the sacrifices easier to manage for students and their families. The rewards are great. When students share their experience, they say things like this. In transition nursing, I studied about 6 hours every day, including weekends. Just before a test, it would be more than 6. My family support system has helped me survive. My husband cooks, my parents help with my kids. I couldn't have done it if I had tried to work, take care of my family, survive nursing school, and take general education classes. I think it would be impossible. One reason nursing is so time-consuming is that it's a new way to learn. You don't memorize. You take everything you've learned and you make it functional in nursing care. Thank you.